Member for North Vancouver Seymour.
Thank you, Mr. Speaker. Today I'm glad to be speaking from the territories of the Lekwungen people, the Esquimalt and Songhees, and I also continue to work, live and learn in my beautiful riding of North Vancouver Seymour, situated in the unceded territory of the Coast Salish, specifically the Tsleil-Waututh and Squamish nations. I want to take the opportunity this morning to say thank you to the member from Prince George Valemont for her unwavering commitment and support of healthcare providers and their clients, particularly those in rural and northern British Columbia. It is great to see members from both sides of the House working together to strengthen our network of public health care. As a community health care provider, I've had the opportunity over many years to work with a vast range of clinicians. On Saturday past, I was at the Coldest Night Walk and met one of my colleagues who I hadn't seen for a long, long time. And I had worked with her when I was a home support supervisor. She was a community health worker who provided in-home care to folks who needed ongoing support in order to remain in their homes. As a registered nurse supervisor, I depended on the CHWs who saw their clients every day to get back to me with observed changes. As an example, a CHW would report that Mrs. Smith was no longer able to call the CHW by name when she had been able to do so in the preceding visits. This report would trigger a visit from a clinician who knew her best, perhaps a home care nurse, or an occupational therapist, or a physiotherapist. They in turn would recommend next steps, which might include seeing her GP. Or that visit may have revealed that her meds were not being taken appropriately, or she was not eating well, or she was improperly hydrated, or a myriad of other things that could be going on that could lead to temporary changes. But sometimes those changes are not temporary, Mr. Speaker, and that's when we have a system that gets us to the next level of assessment and care and treatment. And in the community, we are very lucky. We have a variety of staff in a variety of communities, and it's different in each community throughout British Columbia, and I recognize that. I have had the opportunity to work in Bella Coola, doing work and assessments there, and I've been in a variety of other places in British Columbia, including Prince George, where I actually have a friend who's a nurse and emerge there. And in community, we have a variety of clinicians who are there to try and make sure that people can stay in their homes. And in that group is nurse practitioners. Now, nurse practitioners are something that have been around for a while now and have been working in a range that has been slowly but surely expanding. They too do assessments. They too are able to meet with clients, do some prescriptions, be able to order and read blood work, and recommend next steps for clients. And they are working in a variety of places throughout our province, and we're working to make more nurse practitioners available and able to work in different areas of the province. We also have a number of folks that have expanded their scope of practice. So as an example, I was meeting with the ophthalmologists that are working in my riding. And one thing I didn't know, which I found very interesting, was that if you have an eye emergency, you can actually go directly to your ophthalmologist because they have the equipment right in their office to do an assessment. They have the capacity to make a treatment plan and to implement that treatment plan right away. And they also have access to next steps if you need to see somebody at a higher level of specialty. So we have our ophthalmologists. We also have our pharmacists with expanded scope now. And they are able to, for instance, renew prescriptions, which is cutting back on the workload for our GPs. And that's been in place over the last while and is working quite effectively. I was speaking with pharmacists and GPs also in my community, and they're finding it's making quite a difference. We also can look at dentists. Again, dental emergency. You can go to your dentist directly to be seen for a dental emergency rather than going through a merge and having to wait there for a dental specialist to come and see you. So these things are out there, and the work is being done to expand. The other thing we need to be aware of is that we're working to make sure that our pool of physicians is getting deeper and broader each day with the various programs that we have implemented.
Thank you,
Thank you very much, Mr. Speaker.
Thank you, member.